Hey guys, Dr. Kilfoil here with Podiatry Explained. Today we have another debridement video. We have a patient with diabetic neuropathy. Of course, he's given us permission to release this video for educational purposes. Thank you, Mr. Jones. So here you can see a significant amount of macerated skin in between his first and second toe. We call this the first interspace. Now, this is not a typical place you see this significant amount of maceration. Unfortunately, this patient, despite trying his best to be compliant, he still has to work. And he works at a nursing home, and he is a dietary aide. So he's working in the kitchen. He's wearing shoes that are up to code, and so he's not got much breathable, shoes. He doesn't have shoes that are very breathable, excuse me. And so that leads to a very wet environment, and that's why this skin is that white, friable, easily pulled away kind of look to it. And that's called macerated skin. I'm concerned that underneath this macerated skin there is an abscess or something. It's hiding something. I don't want to create a house party for bacteria, so we have to de-roof this thing. We have to blow the roof off the joint. So here you see I'm using my regular old nipper that I'm going to use on nails later. The Bianco brothers, and I'll shout them out for free. Boys, hit me up if you want me to if you want to sponsor me. We're going to just remove as much non-viable tissue as possible. The body isn't going to retake this macerated skin once that stuff gone. So we're going to let it go. See you later. So if it has a roof on it, the thing is that it's going to possibly house a bunch of bacteria. When you open those things up, you smell it. This is not a thing that you really want to have on your body. So this is a part of the job as a podiatrist. It's not glorious, whatever. People ask me if I would do it all again. If I do it, my patients are typically non-compliant diabetics. I'd rather have compliant women who think their boobs are too small. But hey, this is how we go. This is how life goes. So here I am, I'm throwing a freebie Onico debridement on top of it. It's nothing to me. It's an extra 2 or 3 minutes of work. Patients are happy. That's really what matters. And since he gave me permission to put it on camera, we're going to take a video of it, and we're going to see what kind of freaks actually watch this crap on freaking YouTube. Mycotic nails. Now, when it comes to aggressive treatment of mycotic nails, this is the kind of patient that needs to be aggressively treated. You'll talk to some, I'm trying not to use the B word, some Umer Bay Odiatrist pays who refuse to give oral treatment for this. These are the guys who need it. These are the guys who need it. They have a ridiculously disgusting nails that are pushing into their skin, growing fast and thick. They need to be cured of this. This is not for something for somebody to neglect because, oh, you had diabetes, so you can't get Lamisil. Dude, get away from that doctor if he says that to you. So I noticed now that there's a new wound. This guy has a bunion. And because his bunion is pushing the big toe against the little toes like that, and he doesn't feel anything because he has neuropathy, he's developed a new wound in between his first and second toe. And you can see me, I'm talking to him, I'm trying to gesture to him, and he doesn't speak English as his first language. So I'm trying to tell him, man, we also need to correct your bunion. I would not even touch this guy with a 10-foot pole for an elective surgery like that unless his A1C was very, very well controlled. I'm talking in the 7s, the very worst. Anything above 8%, 8.0 plus, you're asking for an infection that you caused. Now, you can see excess skin, callus, hyperkeratotic skin. This is all because there's excessive pressure and friction in between his first and second toe. That mycotic nail isn't helping either. Boomers. Anyway, there is an open wound there. You'll see me, I use a curette and I punch into it a little bit. I want to make sure it doesn't probe to bone. When you see a wound, when you're evaluating a wound, when you're cleaning a wound, for my zombie apocalypse fans, you want to make sure that shit doesn't probe to bone. That is a good factor that you have an osteomyelitis and that this person needs antibiotics. Even if there isn't exactly clinical evidence of infection, if it probes to bone, it's very likely to be infected. All right, so just moving on. Lateral hallux. Now, bunion is when the big toe pushes onto the little toes. It may or may not have that big giant bump. It may just be the bump. It doesn't push too much on it. Either way, it's a constellation of these symptoms. And when you have neuropathy, you don't feel it. This is a possible consequence. motivation to have this thing corrected. I sent him to his doctor. I want him to get cleared for surgery as soon as possible. He's going to have the plastisode inserts, custom-made shoes. He's going to have all this crap. He's got deformity and neuropathy. His pulses are okay, which, you know, decreases his risk for amputation. But he's this close. He's so close. And I don't think he knows it. His daughter's actually a doctor in Mexico. And I talked to her on the phone, and he had a really interesting complication because every time that he'd get blood from his primary doctor, pretty much it would hemolyze, and so it showed that he had hyperkalemia or some wild shit. So he'd get sent to the emergency room every time he get his blood taken, and then when in the emergency room it was taken correctly. So they're like, "There's nothing wrong with your labs, sir. So please, Gomer." And this happened to him like 3 times before they figured out that he was hemolyzing his blood samples at his primary doctor's office, or whoever was taking his blood. So here we are. We're debriding the lateral wound now with a curette. I want to see if this probes to his IPJ joint. If this probes to the interphalangeal joint, IPJ, of his big toe, that might mean that we need to bring this to the operating room and wash it out. It didn't, thank God. And now we're just going to do some regular foot hygiene. So these patients, they're 30-minute patients. You know, these insurances pay us good money to do these debridements. You should add on to these extras when the patients need them. Because in this exact situation, you find a secret abscess. So this is just like a hard callus. There's a previous ulcer site here. You never know, like, how if that osteomyelitis is still festering down underneath there, so you got to make sure there's something popped out. Now, this patient's really concerned that I'm opening up his wound that he just healed. He's like, "Is everything else, you know, like, is it closed? It's closed, right?" I'm like, "Oh, it looks closed. It looks closed." And then I'm just taking down the callus until I see some blanching skin. What I mean by blanching is I can do that to it. I want to see that blanching happen. And when it's calloused up, I can't see that. So I'm just keep going. Let's see what happens. And eventually, you see that there's some pus hiding somewhere. Now, it looks like epithelialized skin underneath there's a little layer surrounded by the callus on one side and regular skin on the other. So as long as I take it out and I don't see any actual clean wound on the bottom or granulation tissue on the bottom or fibrotic tissue on the bottom, I just see something that looks good on the bottom, and this pocket of pus may just be a sterile abscess, or the body's already kicking it out one way or another. My concern is very low. And I make sure to communicate that to the patient so that they know that, yeah, I'm not worried about this little one. This one is not the biggest concern that you have. This guy on the right, where you need the bunion surgery, where you're having the new wounds and the macerated skin, these are your biggest problems. All right, so now I'm just closing up this, I'm wrapping up, or I thought I was. That's tracing, gauze, separation. I want to reduce pressure and friction with my padding, with my dressing, with offloading felt pads. I didn't have good feelings about leaving this much callus on there. You'd be surprised. Sometimes this leads you down a rabbit hole that you wish you didn't open up. Man, I wish I did boobs. So that's pretty much it, guys. Thanks for watching. Like and subscribe. Hit that notification bell, please, right now. If you're a fan, get the videos as they come out. I hope you like that animation video that we just put out recently. Listen, guys, just remember, every day is the best day of your life.